Hi, this is Dr. Mike Abrams, bringing you another video about psychology, neuroscience, and topics that might be relevant to your well-being. Today I'm going to be talking about the effectiveness or efficacy of psychotherapy. To get a full understanding of whether it does anything or how much it helps, we have to take a look back to its origin. The origin of the research began in 1952, where this gadfly, brilliant nonetheless, Hans Eysenck. Hans Eysenck lived from 1916 to 1997 and contributed to almost every major area of psychology. Eysenck obtained the records of approximately 8,000 people in treatment receiving either intensive outpatient care or inpatient psychiatric care. He compared them to a large cohort of people who received standard care without psychotherapy. The question was, did psychotherapy help? Well, let's look at some of the data. This chart indicates that 44% of people improved with psychoanalytic therapies, 64% with eclectic therapies, and 72% improved without any therapy at all. What do these data mean? Well, in effect, they were a gauntlet thrown at the feet of the mental health profession. Psychiatrists, psychologists, clinical social workers were all told what you're doing does not help. In fact, waiting it out, just taking time off, did better than psychotherapy. This left us with a very frightening prospect that psychotherapy is not at all helpful. You're probably asking yourself, what was the response of the mental health profession? Did they seek to rapidly improve what they're doing, look into these results, conduct their own studies to refute it? They did nothing for 25 years. For a quarter of a century, they continued business as usual, conducting psychoanalysis, psychotherapy, knowing full well that they had no evidence to support what they were doing. Let's look at the implications of this. We had 57 years of psychotherapy beginning in 1895 with Breuer and Freud's studies in hysteria, the early days of psychoanalysis, to Eysenck's study in the early 50s. So for close to 60 years, psychotherapy was conducted without any research evidence that it worked. Now in the present, we have 500 or more named psychotherapies, close to 22 variants of cognitive behavioral therapy, of which there are 70 to 80 that are evidence-based, but dozens of new therapies are introduced each year without any evidence. It's left to you, the consumer, to study this history to see how it applies to the moment. In 1977, Mary Smith and Jean Glass applied a new technique called meta-analysis, which combines data from a vast number of studies into the equivalent of one very large study. And they found that psychotherapy did help. Let me show you some of these data. In order to best appreciate the data I'm going to show you, it's good to have a feel for something called effect size. It's used in psychotherapy research, medical research, anywhere where there's a contrast between two treatments or treatment and placebo. Here you see an effect size in the table of say 0.61, and it indicates that 23% of the people in a treatment group were improved. Take a look at it for a couple seconds to get the relationship between effect size and improvement gain. Now we're going to take a look at the effect sizes found by Smith and Glass. And as you're going to see in a moment, psychotherapy and the various types of therapies do have an effect compared to no treatment, but nothing that would radically change anyone's life. It helps a little bit. Now that you understand effect size, take a look at these numbers. These were the effect sizes of the many therapies studied by Smith and Glass: psychodynamic, Adlerian therapy, eclectic, transactional analysis, rationally motive behavior therapy, and so on. As you could see, the behaviorally oriented treatments were generally the most effective. In addition, as you saw before, an effect size of 0.6 to 0.7 means that the treatment, whatever being considered, helps about 20–24%. Well, here you see all the therapies had relatively small effect sizes. On average, any of these helped about 20 to 30%. These were starting points. These need to be improved upon. Psychotherapy is a mainstay of mental health treatment, and it does help somewhat. The degree to which it helps varies tremendously based on who's doing it, along with the approach they take. However, the caution we get from today's talk is that it was used for almost 80 years without any evidence that it worked. And after this 80-year hiatus, it was shown to be mildly effective. In coming videos, I'm going to explain the specific factors of psychotherapy versus the unique factors for each psychotherapy and how they can be researched, and what you, as a potential mental health consumer, need to ask for, seek, and how to determine the difference between a good therapist, a less competent one, and a good therapy and therapeutic approach. Thanks very much. See you next time.